In this film, we aim to demonstrate terminal chop, new technique for full-thickness nuclear segmentation in hard mature cataracts. The authors have no financial interest in the subject matter of this film. Hard mature cataracts are virtually all nucleus with nearly absent cortical and epinuclear buffering material. Nuclear fibers are tight, sclerosed and densely packed, making the cataract very hard, leathery and unbreakable. It's always been a challenge to achieve full-thickness nuclear segmentation in sclerotic, leathery, hard mature cataracts with the current surgical techniques. Physically hard mature cataracts are identical to solid hard rock, stronger in compression but weaker in tensile strength. It's relatively easier to split or pull apart these hard nuclei than to compress, chop, sculpt or fracture. To achieve full-thickness nuclear segmentation, it's always better to apply lateral separation or dispersive forces instead of compressive forces at the point of natural weakness along the cleavage plane between the lens fibers. Terminal chop is about utilization of unique mechanical forces to pull apart and split the nucleus from its weakest soft and thin equator along the anatomical arrangement of lens fibers to achieve full-thickness nuclear segmentation in hard mature cataract. Techniques which are currently used, such as divide and conquer described by Gimbel and stop and chop made popular by Koch, require wide and long sculpting deep into the center of the nucleus. Utilizing compressive forces at the strongest bulky hard central nucleus very close to posterior capsule to fracture the hard nucleus. Similarly, Nagaharu's horizontal chop technique also utilizes compressive forces deep at the strongest central nucleus. Drawing the chopper through the dense, hard, leathery, bulky central nucleus is often difficult. Misdirected vector forces cause rotation of the nucleus, resulting into incomplete nuclear segmentation. Incomplete nuclear division, along with conjoined segments, need unnecessary prolonged manipulation with excessive use of phaco energy. In terminal chop, instead of compressive forces, dispersive mechanical forces are used at thinnest and weakest equator of the nucleus. Without penetrating deep into the nucleus, phaco probe achieves firm hold of the nucleus at the equator along with blunt chopper. Lateral separation force initiated at the equator simply traverses through the entire nucleus and results into full-thickness nuclear segmentation. To achieve perfect dynamics of terminal chop, it is important to create a large central capsular axis with an intended 5.5 to 6 mm in diameter. Short, shallow, narrow central trenches created sufficient to fit the phaco tip to achieve a proper plane of depth in the nucleus. Phaco tip is then engaged at the distal end of trench and impaled towards equator within the superficial plane of nucleus to achieve a firm grip at the equator of the nucleus. Thin and soft equator of the nucleus is then hooked with blunt chopper after drawing and lifting the nucleus edge within the capsulotome margin. Chopper is then drawn into thin and soft nucleus to create a small full thickness nick adjacent to the phaco tip. Chopper then takes firm hold of the nucleus within the initial nick without making any horizontal excursion, stays at the equator adjacent to the phaco tip to hold the nucleus. Once both the edges of initial nick is firmly held with phaco tip and chopper, a controlled full-thickness nuclear tear is initiated using laterally directed vector forces. The mechanics behind this technique is quite analogous to tearing a fabric along a cleavage plane within the parallel fibers, which requires an initial nick at the terminal edge of the fabric. Then, by closely holding both the edges of initial nick, lateral separation force is applied to split the entire fabric into two complete segments. The concept of terminal chop technique evolved with extensive clinical experiments performed on the extracted hard nucleus procured from the extracapsular cataract surgery in our clinical setup. Division of nucleus was only possible after holding the equator of the nucleus with phaco probe and blunt chopper adjacent to the initial nick. Consonant to tearing a fabric, internal chop, full thickness nick is given at the soft and thin equator of the nucleus with a blunt chopper. Then both the edges of the initial nick is firmly held with both blunt chopper and phaco tip, which is already impaled and positioned at the equator. Lateral separation of both the instruments create a vector force which tear the full thickness initial nick from equator to equator through the center, segmenting the entire nucleus along a clean cleavage plane between the lens fibers. We recommend specially designed Rajendra Prasad's 80-degree angulated blunt chopper with a smooth olive tip. This enables firm grip and safe manipulation of the lens equator with no threat to the posterior capsule. Terminal chop takes the advantages of anatomical configuration of crystalline lens, which is quite soft and narrow at the equator. This is due to the unique arrangements of lens fibers which extend from posterior to the anterior poles while crossing a plane passing through the equator. Fibers are very densely packed at the poles, making the nucleus very bulky, hard, leathery and unbreakable at the center. But while passing through the equator, these fibers are sparsely arranged, making the nucleus very weak, thin, soft, with wide cleavage plane at the equator. Hence, it's always easy to achieve a natural cleavage plane between the lens fibers and initiate the tear at the equator rather than penetrating deep into the center of the nucleus. To achieve perfect dynamics of terminal chop, it is important to create a large capsular axis with an intended 5.5 to 6 mm in diameter. Once the axis is complete, a short superficial central trench is sculpted in the nucleus, sufficient to hold and engage the phaco tip. Then, using the hyperpulse or burst mode with high vacuum settings, the phaco tip is engaged at the distal end of the trench and then impaled full length into the nucleus, keeping the tip directed towards the equator superficially parallel to the pupillary plane to achieve a firm grip at the periphery of the nucleus. While nucleus is firmly held in position with phaco tip, equator of the nucleus is then slightly lifted vertically and brought out at the capsulotomy edge. Blunt chopper is then very simply hooked around the lens equator. The blunt chopper is then drawn just a mm into the thin and softer terminal edge of the nucleus to create a small, full-thickness nick adjacent to the phaco tip. Chopper then takes position within the nick to achieve a firm hold of the nucleus and stays there. Do not make any horizontal excursion. Once both the instruments have achieved firm grip of the nucleus at the equator, chopper and phaco tip are then separated 90 degrees laterally to initiate the nuclear tear from the initial nick given at the equatorial edge of the nucleus. The force vector of 90 degrees lateral separation is then continued until splitting the entire nucleus from the equator to equator through the center into two complete clean halves. Once complete nuclear division is achieved, the nucleus rotated 90 degrees and the same procedure is repeated to further chop the nucleus into multiple fragments. The free lens fragments are then very simply and quickly emulsified and consumed. The unique mechanics utilized in terminal chop is based on and make full use of A. Principle of breaking a rock. Don't compress, split the hard object along the natural cleavage plane. B. Structural configuration of lens with unique anatomical arrangement of lens fibers. Find weakest natural point of object. C. Mechanics of tearing a fabric. Initiate the split with small nick at the edge of object. To conclude, full-thickness nuclear segmentation is crucial in performing quick, safe and uneventful phacoemulsification in mature hard cataract. Complete nuclear segmentation achieved with terminal chop is extremely safe, as the dispersive forces are working away from the posterior capsule with least manipulation. Terminal chop is highly efficient, least traumatic, giving minimal stress on the zonules and posterior capsule while preserving the integrity of the endothelium and the uveal tissue. The crux of the terminal chop is, don't go deep, stay superficial. Hold the nucleus at the equator, not deep at the posterior pole. Don't use compressive forces, split the nucleus with dispersive force. Thank you for being with the terminal chop in this video demonstration.